Everything you need to know about fibroids. Uterine fibroids are non-cancerous tumors that grow in the muscular layers of the uterus. The size of these benign soft muscle tumors can vary from the size of a bean to as large as a cantaloupe. Fibroids are most common during the reproductive years. The exact cause is unknown, but they tend to develop when estrogen levels are high. Most women have no symptoms, but when they do occur, they can include low back pain, constipation, and excessive or painful uterine bleeding that can lead to anemia. There are 4 types of fibroids. Intramural fibroids, this is the most common type. An intramural fibroma is embedded in the muscular wall of the uterus. Subserous fibroids, these fibroids extend beyond the wall of the uterus and grow into the outer layer that surrounds the uterine tissue. They can become pedunculated, in which the fibroma has a kind of stem and can reach a considerable size. Submucosal fibroids, this type of fibroma can press on the cavity of the uterus. They are usually found in the muscle under the inner lining of the uterine wall. Cervical fibroids, these fibroids grow on the cervix, also known as the cervix or cervix. 2. Symptoms. About 1 in 3 women with fibroids will experience symptoms. These may include heavy and painful periods, also known as menorrhagia, anemia due to heavy bleeding, lower back or leg pain, constipation, discomfort in the lower abdomen, especially in the case of large fibroids, urinate frequently, pain when having sex, known as dyspareunia. Other possible symptoms include problems during childbirth, problems during pregnancy, fertility problems, frequent miscarriages. 3. Causes. The exact cause of fibroids is not known. They may be related to estrogen levels. During the reproductive years, estrogen and progesterone levels are highest. When estrogen levels are high, especially during pregnancy, fibroids tend to become inflamed. They are also very likely to develop when a woman takes birth control pills that contain estrogen. 4. Diagnosis. Because fibroids often have no symptoms, they are usually diagnosed during routine pelvic exams. The following diagnostic tests can detect fibroids and rule out other conditions. A doctor can create ultrasound images by scanning the abdomen or inserting a small ultrasound probe into the vagina. Both methods may be necessary. An MRI, magnetic resonance imaging, can determine the size and number of fibroids. 5. Treatment. Fibroid treatment is only recommended for those women who have symptoms as a result of fibroids. If these do not affect quality of life, treatment may not be necessary. Fibroids can cause heavy menstrual cycles, but if they do not cause major problems, a woman may choose not to receive any treatment. During menopause, fibroids often shrink and symptoms become less noticeable or even resolve completely.